Marcy Swelling here. How are you? And welcome to Global Medicine. I'm an internist in Southern California, dedicated to bringing healthcare to people all over the world, affordable, accessible healthcare. Today, our guest is Ruben Toral, the CEO of Medeguide Holdings. Hi, Ruben.
Hi, Marcy. How are you?
It's a pleasure to have you, and I'm always good. You know that.
I do.
So I understand you were born here in America, but I think you live in Bangkok, Thailand. How did you get all the way over there to Bangkok, Thailand? What were you doing?
Call it luck, call it misplacement, call it what you will. But effectively, I was working in the United States about 20 years ago and ended up meeting a doctor based out of North Carolina who pioneered lithotripsy, at least mobile lithotripsy. So I started to work with him in Asia, and we set up offices in Thailand, Australia, Indonesia, Malaysia, and the Philippines. And then I ended up coming to Mexico and setting up our operations in Mexico and Panama, and then went back to Bangkok. So for the last 20 years, I've effectively been out of the United States, living overseas and working in healthcare.
Wow. And lots of English in Bangkok or no English in Bangkok? Is it difficult to find other Americans in Bangkok?
No, there's probably about 250,000 expatriates living in Bangkok, and Asia, as you know, is a real hotbed for economic activity right now. So whether you're in Bangkok or Singapore, Shanghai, Kuala Lumpur, or Manila, it's quite easy to find English-speaking expats and, of course, doctors.
Absolutely. Now, I think you did some work in Bangkok in the field of medical tourism. And if I'm correct, you're one of the pioneers in medical tourism. Please tell us all about that and your experience in Bangkok.
Well, when I started to work, when I came back to Bangkok for the second time back in 2001, I was working for a large multi-specialty hospital located in the center of Bangkok called Bumrungrad International Hospital. Actually, at the time that I arrived, it was just called Bumrungrad Hospital. And I was effectively hired to help expand their international program. The hospital had effectively all the American facilities or all had American doctors, American equipment, American management, and what they were trying to do was effectively try to pull patients from the region to come to this particular hospital. And so I was in charge of attracting patients from other countries into Thailand for medical treatment. That was very, very successful, and for probably 5 years as director for marketing and international business development, our international patient business grew about 100%. We went from around 150,000 international patients to over 400,000 patients by the time that I left in 2007.
Oh my gosh.
So today, that hospital is effectively the epicenter, the icon of medical tourism because it attracts over 450,000 patients from around the world for everything from cosmetic surgery to spine surgery to heart valve replacement surgery. And the patients who are coming are Middle Easterners, Cambodians, Australians, and Americans. So there is probably no more global hospital than that hospital, which was also featured in a 60 Minutes piece in 2005.
Fascinating. So what drives people to go to Thailand, of all places, to get health care? I mean, I can go down the street to my hospital down the street. Why would I want to go to Thailand?
Well, you know, people travel overseas for healthcare for 3 reasons, and about 3 reasons only. One is cost. They can't afford it. Obviously, as you know, there's a lot of people in the United States who just cannot afford U.S. healthcare because it's expensive. People leave because of quality. They may not be able to find the expertise or the technical capability in their home country. We're not just talking about Americans, we're talking about anybody. And the other issue is access. Again, you will find in social healthcare systems like Canada and the UK that oftentimes you'll have to wait 6, 8, 12 months sometimes for surgical treatment. So a lot of people don't want to wait, and for either cost reasons, quality reasons, or access reasons, people decide, I'll look overseas to find something that's faster, cheaper, or better.
And you have obviously been successful. Now, explain to me about the Medeguide. You're the Medeguide, you're the CEO of Medeguide. As I understand it, there are, I mean, Bangkok is an example of a hospital overseas, but there are hundreds of hospitals overseas that are now involved in this concept of medical tourism, people looking for good quality health care at affordable prices. And I understand the Medeguide helps them find those places and find those doctors?
Yeah, there are literally thousands of hospitals around the world that are effectively trying to attract patients all over the world to come to them. And I think this is what we're seeing in the, if you will, the globalization of healthcare, that healthcare used to be local and now it's global. And again, hospitals and doctors aren't looking at their patients just coming from 10 miles or 20 miles away. They're looking at them coming from 10,000 miles away. So effectively, a lot of the hospitals have done a very good job at positioning themselves, particularly on the web, and trying to advertise their services in order to attract patients from around the world. Doctors, however, are less, if you will, web or advertising savvy. And I think that at the end of the day, an individual who's thinking about traveling overseas for medical treatment is really traveling for the doctor. They want to know that the physician that they're going to see is qualified and is validated by other people who have used that doctor. So effectively, that was the hole in the market that I saw, that a lot of the hospitals were doing a great job advertising and marketing themselves online, but the doctors really were kind of in the background and needed to come into the foreground, because this is really what the patient wants to see. They want to know, does my doctor speak English? What procedures or treatments does he offer? Is he U.S. or internationally board certified and trained? What do other patients say about that doctor? And so what we've effectively created is a way that you can search doctor by name, by country, specialty, treatments that they do, hospitals where they work, and countries that they live in.
Fascinating. So I'm a patient here anywhere in the world, and I need my knee operated on, for instance. So I would go to your website, Medeguide, and I would look up orthopedist or knee operation, and I would have a list of doctors. Can I interview them?
Sure. Well, effectively what we do is we are an interface that allows you to search, find, and connect with those doctors. Once you've found your doctor, then you can effectively connect to them and say, I'm a patient, I'm interested in, let's say, knee replacement surgery. Can you tell me more about price, procedures, techniques that you use, on and on and on. So effectively, we help patients find those doctors and then create that initial connection, and then we step back and leave it between the doctor and the patient, because effectively we do not want to get in the middle of that relationship.
I understand. Now, as a doctor back here, I believe in continuity of care. That's just so important, that whatever procedure, operation, whatever is being done, that there's follow-up. How is that done when you're 2,000 miles away?
Well, it's tricky, actually. I think one of the issues with this globalized healthcare is, how do you create that continuity of care? And I think here, one of the things that we're trying to do is engage physicians like yourself who live in the United States to connect with physicians who are overseas, to become the bridge between patient and the eventual doctor that they may see overseas. Because the last thing that any doctor overseas wants to see is a patient who is effectively not equipped or not prepared for surgery, or is not a candidate for surgery. So let's take a case of our hip replacement patient. If that hip replacement patient talks to you, a concierge physician, and says, look, Dr. Marcy, I cannot afford medical treatment here because I'm either ineligible or I'm not covered by insurance, and I'm looking at traveling to Thailand or Mexico or Turkey for medical treatment. Tell me what my options are. Help me validate that I am a candidate to travel overseas for medical treatment, and can you help interface with my doctor to make sure that he's got the medical information that he needs or she needs in order to perform the surgery. This is one of the things that I think is missing from this whole global conversation, is the intermediary doctor like yourself who plays that role in the United States between you, or between the patient and a specialist. So many of the hospitals are very, very good at creating a dialogue and working with patients in order to get their information and make sure that they are, in fact, a good candidate to come over for medical treatment. But I think having doctors like yourself in the conversation even makes that stronger. And it provides continuity of care when they come back.
Absolutely. So perhaps we should let the audience in on the fact that we actually do know each other, and I had the privilege of going with you to both Brazil and to Turkey. And one of the things that I found most fascinating was, first of all, the hospitals that you described. They're like the Four Seasons here in the United States. Beautiful hospitals, lovely food, and the accoutrements are just fascinating. And among those was that good big TV set that sat in the middle of every room, where patients were actually talking to their doctor back in the United States. So as we are talking here through the internet and the cloud, it actually does expedite that and allow that to happen. So there's no reason why I couldn't, even from the United States, watch a surgery that was happening in Turkey, because all of those things are set up now. I could talk to my patient as they're sitting in their bed, and I found that absolutely positively fascinating. We haven't used it enough, but indeed the continuity of care and the idea that the patient has to always show up in a doctor's office to get their follow-up is really not valid anymore, is it, in this global world? We need to be using these IT mechanisms, yes?
Correct. I mean, the conversation that we're having, we're thousands and thousands of miles apart, separated by time differences, but it doesn't really matter. And I think that this is one of the really interesting things that's happening in medicine, is that a lot of the transformation is taking place because the technology, the information technology, and the communication technology has changed as well. So effectively, we could have on this conversation another doctor from Turkey, and all of a sudden it would be me, the patient, you, my physician here in the United States, and the overseas doctor. And this is really this is really a glimpse into the future of globalized medicine, and the idea that you do not have to just look at options that are local. You really have global options. And I think that one of the amazing things here is that there are a lot of excellent doctors overseas that are U.S. board trained, have lived and worked in the United States, and have gone back home. So for all intents and purposes, you are, as an American, seeing an American doctor in a place like Mexico or Turkey or Brazil or Thailand. It's just that they happen to live there, and oftentimes you will pay 50–70% less because they live overseas.
And indeed, we, in fact, that is going to be, some of our next interviews are going to be with those doctors that I met overseas, because I found them to be fascinating, passionate, and I think most importantly, very much like us here in the United States. Every doctor that I met around the world wanted the same thing for their patients, good health care. They were all passionate about health care and about their patients. I was really overwhelmed by how much alike every doctor was. The professionalism is really global, absolutely positively. And I can't wait to bring our viewers interviews with some of these doctors. Particularly, I think you'll remember, there was a doctor that we met in Istanbul that was a pediatric cardiologist. Mm. She stood about 4 foot tall, and she just brought so much energy into the room. and all she could talk about was her babies, the babies whose lives she was saving. And I think that Americans need to understand that healthcare is now a global marketplace. And I'm wondering, as Americans are facing the ACA, or what we call Obamacare here, and this incredible bureaucratic thing, I don't know what else to call it. Have you started to see Americans looking into opportunities over abroad more? Are they exploring other opportunities? Are they seeing that America may not be the only place to get health care?
Yes, I am. I mean, whether or not the Obamacare or the Affordable Care Act is stimulating more people today to travel overseas for medical care, that's hard to gauge. But I think, without a doubt, Americans are starting to understand more and more that there are global options available. And 10 years ago, this wasn't the case. And for a lot of different reasons, because very frankly, the healthcare system in the United States is extremely process-driven, as you well know. And I think that this is the single biggest difference that you find between healthcare outside America and healthcare inside America. Oftentimes people ask me, what's the difference? And I said, one system is process-driven and the other one is patient-driven. And my sense here is that I have never met anybody who's gone overseas for medical care who hasn't come back and said, wow, what an experience. And of course, they're saying that in a positive way. And when was the last time that you heard anybody go to a hospital and come back and go, wow, what an experience? It doesn't happen. And I think that as more Americans get exposure, real exposure to what is available beyond their borders, they're going to start taking it upon themselves to start looking at those options in a much more serious fashion. And they're going to start demanding from their employers or insurance companies, develop a product that allows me to go overseas.
Interesting. Now, we've seen some interesting partnerships that are also taking place, I think, between American hospitals and hospitals overseas. Am I correct that Johns Hopkins, the Cleveland Clinic, are finding places overseas? Is that another medical tourism kind of opportunity, or is that something different?
It's a bit of a hybrid. Hospitals like Hopkins, MD Anderson, the Cleveland Clinic, Mayo, have been, I would say, more active in developing international or their international profile, because a lot of governments or hospitals or investors in those countries pull them in because these are the top names in the United States. Okay, are these medical tourism hospitals? No, they're not. They're hospitals that are there developed to effectively treat the local population. But I think here what it does is it sets a precedent for this whole concept that names and doctors and systems are movable. So the fact that Hopkins can set up, a cancer center in Singapore or a hospital in the Middle East and have the Hopkins name and the Hopkins reputation and the Hopkins system behind it makes a lot of the Americans who might be traveling to those countries a lot more comfortable, because they know that there is a brand name that they know well in the United States that is operating overseas. And I think that this is just a baby step to what we are going to see in the next 5, 10, 15, 20 years, where you're really going to have global networks of hospitals that are, again, Mayo or Hopkins or others that form these partnerships. And again, in the United States, you have these what you call in-network for hospitals and doctors that you can go to and that your insurer allows you to go to. But if you kind of expand that idea a little bit more into a global network, then effectively you could be going to Mexico or Thailand or Turkey or Brazil and be seeing doctors within that network just as easily as you'd be seeing doctors in a U.S. network. And that's really where this is headed.
I think that's fascinating. So just to sum up a little bit, I think what we've said here is patients, first of all, need a doctor, that
Yeah.
they're to this by the excellence of a physician and the professionalism of a physician, regardless of where they are around the world. That doctor then is affiliated with a hospital that is an expert and is able to accomplish whatever procedure he needs to do. In fact, we saw in Turkey they were actually building an orthopedic hospital where a team of orthopedists, a huge team of orthopedists, were actually almost driven to the hospital because of the hospital's expertise. So the patient finds the doctor finds the hospital, and let me get this straight. The patient gets on a plane, lands in Thailand or Istanbul or wherever. Somebody picks them up, takes them to the hospital. They have their surgery. There's a connect between the doctor back here in the United States and back there in whatever country. Patient comes back here, continuity of care via the internet, case closed. Am I correct? It's just that easy?
Well, yes. I mean, and let's let's put this into a real perspective. This happens every day. This happens every day. I mean, there are patients leaving their city, their state, or their country, and going overseas on their own power, oftentimes very unassisted, and getting medical treatment and coming back home. I think the link that is missing right now is the resource for a lot of American patients to find American doctors like yourself who are willing to act as the interface for international doctors, because as you well know, a lot of doctors will go, that's not my business. I recommend that you do not go overseas and travel overseas. You don't know what you're going for. And a lot of times that is driven because, very frankly, because they don't know any better. They don't know what exists beyond their borders. Doctors, as intelligent people, but again, if their worldview is closed and is only focused on the United States, that's all they know.
You're absolutely right. Because I work for my patients, they tell me what they want. And believe me, they are looking at this as an opportunity. We actually have a question from a viewer, and here's the question. What are the top surgeries that are done overseas because of cost?
Well, some of the top surgeries performed overseas turn out to be, number one, plastic surgery. Okay, and because these are surgeries that are not covered by an insurer or an employer, they are out of pocket, and so what you will find is that a savvy health consumer will oftentimes look at options overseas because the savings can be huge. As an example, a facelift in the United States may be $25,000, $30,000. In a place like Thailand, it's $10,000. So you can start to see the.
I'm beginning to look. Yeah.
Marcy, leave it alone. But I think as a rule, the higher the intensity of the procedure, the bigger the savings. So when you start to take a look at spine surgery, again, those price differentials could be 60, 80,000 in the United States. It could be 20,000 overseas. Bypass surgery, maybe 100,000 in the United States. It could be 25, 30,000 dollars overseas. So you can start to see a real gap happening. The higher you go up into the intensity level, and as you get into things like transplantation, it gets even bigger.
And one of the things I noticed when we were in Istanbul was the way they, not just how they financed this, but how they dealt with it. So in our hospitals, we have people like standing in line at the cashier, basically, or getting these horrendous bills at home and having if they didn't have a heart attack in the hospital, the EOB or the explanation of benefits will give them a heart attack after they get home. But what I found is that they get one bill, and they have an opportunity to pay for it, even get it financed. So if they need bypass surgery, their copay here could be as much as $10,000 or $15,000. And then they have all the other copays, the doctor, the hospital, the pathologist, you name it, the laboratory. But if I recall, there was one bill. It was one-stop shopping. They brought it to the patient's room. The patient arranged their financing, and they left the hospital having either paid it in full or had an arrangement for that one bill to be paid. Am I correct?
Yeah, and I think it's the huge difference in payment systems, and this isn't kind of universal all over the world, but for the purposes of this conversation, this is how it works. When you travel overseas, and a lot of patients who get private healthcare overseas, they pay for that out of pocket. That is a cash payment, okay? And you would almost, I don't think any American would ever consider paying for their bypass surgery paying cash, because effectively that would be $80,000, and very frankly, who's got that lying around? But in the United States, it's a third-party payer. There's an insurance company, there's an employer, there's somebody else paying the bill. And because someone else pays the bill, it becomes very procedure-driven and very process-oriented. When you go overseas to, for example, the hospital that I worked in Bangkok, they will tell you up front, these are the prices, and oftentimes they have package prices, all-inclusive prices for their surgical procedures, and that is the price that you pay at the end of surgery. It is all-inclusive, it is one bill, one price, that's what it is. And I think that that kind of simplicity makes it easy for consumers like you and I to kind of take a look and say, compare between, I may look at Thailand, I may look at Mexico, I may look at Brazil, and using cost as one of those factors by which they can compare apples to apples.
I think it's fascinating. So where do you see this going? I think the audience is, I think it's almost hard to put into our heads the largeness of this business. Where do you think this is going? How big is this business now? How big is it going to be? Are we talking millions of dollars, billions of dollars? What are we talking about in terms of the growth rate of this business?
Well, that's a good question, and there's a question mark besides that. Everybody knows that there are literally millions and millions of patients traveling every year cross-border for medical treatment. Okay, in my own hospital, the one that I worked at, they saw 450,000 patients from around the world coming to that hospital alone for medical treatment. Okay, now if you start to take a look at the cross-border trade between Canadians coming into the United States for example, joint replacement surgery, or Americans going to Mexico, or Mexicans going to, for example, Houston for medical treatment. This is all in the global medical sphere, if you will. No one is tracking this. No one is tracking it in a systematic way that says, aha, we can see where patients are going and we can see how this is growing. Anecdotally, everybody knows it's growing, and many, many more hospitals and doctors are getting involved in it, but no one's got hard stats to say this is what this looks like. That said, if you're asking about the future, I think the future is just what we're doing right now. You are my doctor, and you could be in Turkey for all intents and purposes, and you don't have to be overseas. And again, my ability to go online and shop for the right doctor for me at the right price, at the right place, doing the right procedure is really what technology is enabling us to do. And as long as the consumer has choice and is informed about that choice, well, more power to the patient.
Fascinating. We have another question from Anthony in New York, and he wants to know, are referrals from patients available? On Medeguide, do you have patients that actually go there and look for other patients to refer them to other doctors? Are patients actually making those referrals at all?
No, not really. I think, again, the site that I have is frankly just a quick and easy site to find doctors. There are kind of other sites and ways by which patients oftentimes find other patients who have traveled overseas, but there's a very popular website called Patients Like Me in the United States, where patients who have like issues oftentimes find themselves on a web platform like Patients Like Me to kind of converse. That is one of the tools, if you will, that is missing in global healthcare. And Anthony, if that was your question, it's a good question.
It is a good question. So let's sum up. What we've done here today, I think, is we've recognized the problem in the world is access. Access and cost. That's what we were trying to solve here in the United States with the ACA. We wanted to bring more access to patients at lower cost. And what we've just told the world is, hello, that's available. That's available not necessarily next door, but that's available around the globe. Pick your doctor, create a relationship, use Medeguide as an example, and get your procedure done, get back to work, and give yourself, I always tell people they need a better day. This is a great day when the world can be united around better quality healthcare, legitimate better quality healthcare, not government driven, not insurance driven, but patient driven. I think that's what we're saying here. Patients that need help now have access and an opportunity to find the right doctor, the right place, the right price. It's a wonderful business opportunity. And the idea that with that opportunity comes better health, and then, of course, a better day for the patients, I think is just, it's quite frankly, it's earth-shattering. It is absolutely a business opportunity for every single person that I think most of the world doesn't yet know about. Hopefully they'll watch this and they'll start to know about it.
Yeah, I think there comes an aha moment, and I think the industry, the healthcare complex, if you will, is looking for consumers to knock on their door and demand it. And right now, the idea that consumers are slowly but surely becoming educated to what their options are overseas becomes an important thing, and an informed consumer becomes a demanding consumer. And once that consumer says, I want options and I want global options, then the doctors, the hospitals, the insurers, and the employers have to start to react towards that. Right now, they don't feel like they have to, and very frankly, for them, they see this as a small business as compared to what they're doing every day, in their domestic lives. But I think that this is a huge opportunity, and I would ask anybody who is watching this program or watches it on tape, if you have any questions, please contact me at ruben.toral@medeguide.com, or you can go to www.medeguide.com. You can find me there.
Fabulous. I can't thank you enough for your time and your patience and for letting the world know about this wonderful opportunity. Access at lower cost and good health for the world. That's what this is all about. And I can't thank you for being a part of that good medical community and for being my friend. Thanks for being my first interview on Global Medicine. This is Dr. Z saying, see you around the world.